Sonesta procedures and examination chairs. When quality and design meet to create outstanding results. The Sonesta S3 is a premium 3-motor procedure chair for urology and gynecology procedures. It's designed to be the ultimate in positioning and comfort. The S2 model has a 2-motor foot control, allowing for position changes. The left panel controls the height with a range from 16 to 39 inches. The right panel controls the back panel of the chair for reclining. The S3 model has a 3-motor foot control used for position changes. Panel 1 controls the height with a range from 16 to 41 inches. Panel 2 controls the back panel of the chair. Panel 3 controls the pelvic tilt of the chair. To raise the armrest, press the blue button and push up. To lower the armrest, press the blue button and push down. To convert the footrests into a seat extension, push the black lever in while lifting the footrests up. The length of the footrests can be adjusted by pulling out the black knob on the side. Rotate the handle on the leg rest holder counterclockwise to loosen it. Adjust the height and placement. Then rotate the handle on the leg rest clockwise to tighten and secure. You can adjust the angle of the leg rest pads with the swivel directly underneath the pads. The chair should remain in a lowered, seated position with the footrests folded up when the patient is being seated. Once the patient is seated, the footrests can be lowered. The motor system allows the chair to be easily adjusted into different positions for individual patients. Before raising the patient, lower the footrests and place the patient's feet onto the rests. This step secures the patient during movement. After the procedure, return the chair to a lowered, seated position. Shorten and raise the footrests again to allow the patient to stand up. Note that the S3 features one-touch movement locking mechanism for precise positioning. Unplug the table from the power source before cleaning. Do not use steam cleaning. Both household cleaning disinfectants and hospital-grade disinfectants are recommended for use on the table. The cushion can be cleaned with a bleach disinfectant that has a dilution factor of 1 parts to 10, a PDI Sani-Cloth bleach wipe, or germicidal disposable product can also be used, or Clorox Healthcare disinfecting wipes. Improper cleaning or a failure to clean the chair after each use can damage chair appearance and performance. Ida-4 type disinfectants, such as betadine, may stain the cushions. Prolonged contact with improperly diluted bleach solutions may cause damage to chair appearance and performance. The S3 table is designed to support up to 210 kilograms or 465 pounds. The S2 table can hold up to 170 kilograms or 375 pounds. Please note the table isn't designed to support someone seated on the very end, which could cause the table to tip or otherwise be unsafe. The brakes should be used whenever a patient is on the table or whenever the table is stationary. Sonesta S3, designed especially for you. Sonesta S2, the right tool to facilitate your procedures.